Now for the next stuff we are going to talk about is that's next emergency, right? Is what is known as a pneumothorax. So pneumothorax, you could actually simply understand pneumothorax from defining terminologies. Anytime you hear pneu, they are talking about air. Thorax is the chest. So pneumothorax just simply means there's like so much air packed up in the chest, literally. So pneumothorax literally is just the presence of air in the pleural space between the lung and the chest wall. This would disrupt the negative intrapleural pressure. It causes partial or complete lung collapse. Do you understand? So types of pneumothorax, we have the spontaneous pneumothorax. It occurs without any lung disease beneath. Do you understand? Okay, that's a primary spontaneous pneumothorax. The secondary spontaneous pneumothorax, that one there is a lung condition underneath, okay, like chronic obstructive pulmonary disease, asthma, cystic fibrosis, tuberculosis, right? They will have the traumatic pneumothorax. That one, there's a penetrating chest injury, so there's a chest injury, due to trauma, okay. Then blunt trauma, okay. Then we have the iatrogenic pneumothorax. Now there's complication of medical procedures, okay. It's due to all those medical procedures complication. Okay, so tension pneumothorax, this is when air enters pleural space but cannot escape. Causes mediastinal shift, compression of great vessels, severe hypoxia, and shock. So tension pneumothorax, among all the pneumothorax, is actually the one that I can say is actually through surgical emergency. Okay, so clinical features is there's a lot of chest pains, the person is finding it difficult to breathe, there's decreased breath sounds on affected side, there's hyperresonance on percussion when you try to tap, there's reduced chest expansion, there's tracheal deviation, there's distended neck veins, that's raised jugular venous pressure. So diagnosis, you do all those chest x-rays, you see visible pleural lines with absent lung markings beyond it. You see lung collapse, you see mediastinal shift in tension pneumothorax. Okay, on ultrasound you see the lung point or the absence of lung sliding. Now CT scan is more sensitive, it's used in complex cases. Alright, so management is you have to observe, if you are having a stable pneumothorax, observe, place the person on oxygen. If there's a large or symptomatic pneumothorax, needle aspiration or chest tube insertion, that's tube thoracostomy. The tension pneumothorax, you have to actually put a needle there to freeze out the air, okay, then followed by chest tube insertions and the rest of it. Okay, so that's what we got for the pneumothorax, okay, and everything.